This is Dr. Evan Osar with Chicago Integrative Movement Specialists. I'm so excited to be joined by my friend and colleague, Sherry Belcher. Sherry Belcher is the individual, the professional that we refer our clients and patients to for nutritional consultations and advice. She has worked with me for several years personally, because one of the things that we strive to do here in our clinic is to develop a team of experts in their respective fields. And when I was first setting up our clinic, it was very important to me to find the right individuals. So it took me a long time to find that right nutritional consultant to use for our clinic. And I started to hear a name, Sherry Belcher, from one of my good patients and clients, Susan. And Susan, I know, only goes to people she really respects and has done a lot of research on. And then it was very shortly after that I heard Sherry's name come up again from another patient of mine who had breast cancer and had gone through chemo. And she's like, yeah, Sherry Belcher helped me work through my nutrition and also get me through. She really attributed a lot of her success getting successfully through chemo and recuperating and being a healthy individual afterwards to the work that she did with my friend and colleague, Sherry Belcher. So then I had to meet Sherry Belcher. So we met at a Starbucks many years ago, and I liked what you were saying. I liked your approach. So I personally went to you, and we worked together for quite a few years. And then since then, we've had a very excellent relationship, as well as, like I said, we refer our patients to you so that they can get the same quality of work and information that you share with me. So we're so excited to have you on, to have you share with our community about immunity, their immunity, how to boost their immunity, and how to take advantage of this downtime to really up-level your health. So thank you, Sherry. Thanks for being on. Thanks for all you do for me personally, as well as our community.
Oh, thank you so much for that very kind introduction. And something you said, it is right now about community and immunity, right? Two
Right.
important things, community and immunity. But yeah, it's good to be here.
Awesome. And then on this episode, hopefully this will be one of very many that we do together. We want to bring you some practical information. And just as a caveat before we begin, a little disclaimer: this is not medical advice. We are not your medical professionals. So we are educating you and presenting this information as education only. It's important that you do your due diligence and follow up with your own licensed healthcare professional so you know exactly the recommendations for you, what to do, and whether these recommendations or this information is appropriate for you personally. So please take care and consult with your own medical professional before using any advice anywhere you read on the internet or from other quote unquote experts that are out there that are now masquerading as health and fitness specialists. Awesome. Can you just give our community a brief background about what you do, how you work, and how long you've been practicing?
So I have a master's in clinical nutrition, and I've been in business for over 25 years. And really, bottom line is I try to provide practical solutions for people to get better. I work with corporations. I'm an author. I do some product consulting. So I've branched out a little bit, but basically I want to provide people practical tips to upgrade their health or get healthier.
Awesome. Awesome. Now, one of the things you and I have talked about quite a bit is the importance of the immune system and also inflammation. And obviously we're in unprecedented times right now where people are obviously very concerned about their immune health or their immune system. So can you briefly describe what the immune system is and how it's relating to, the COVID and the coronavirus that we're dealing with right now?
Well, I think a few things. One is the immune system it's a series of pieces in our body that all work together. So it's our white blood cell count, it's the spleen, it's the thymus, it's our lymphatic system, our bone marrow. So all of that kind of compromises our immune system. So just to point one thing out, like let's raise white blood cell count. You don't want to do that. You want to look at the whole picture and the whole piece. And I think that with the supplements and with the things that are going on now, there's three parts of the immune supplement category, and some of them are anti-inflammatory, some of them are antioxidants, and some of them enhance an immune response inside the body. So right now, I think if we focus on working on inflammation, most of us have chronic or acute inflammation and underlying things. Most of us and antioxidants to work on that. I see so many people taking full on supplements as though they're already fighting a virus. I don't think you want to enhance your immune system to keep it at high gear all the time like that, because that creates other problems within your immune system to have hyperimmunity all the time. And then if something does come around, your body just doesn't have what it takes to try to fight it. So focusing on the basics and focusing on improving your diet. I mean, the diet is the core piece for people, and you can do a lot to improve your antioxidant and decrease your inflammation just through your diet.
Awesome. And one of the things I like what you talk about is supplements are a supplement to the diet, that it's not a replacement for your diet. Can you talk about some of the things that you recommend, general recommendations? And anything we talk about on this call, we should have said this in the beginning, is not medical advice. You have to consult with your own medical professional before taking any nutrition advice and or supplementation advice. So please don't take this as gospel. These are just general recommendations for educational purposes only. So what are some of the things that you recommend, Sherry, as a part of that sort of that foundation for building a good immune system and also decreasing general inflammation that many of us experience?
So diet-wise, I recommend that people have a diet that's 35 to 50% vegetables, using a lot of fresh herbs, using leafy greens, but don't just sticking to 7 veggies that you like. Really go out there and get a variety of veggies. Moderate your sugar intake, keep your blood sugar steady, use good quality fats. And the packaged and processed foods, even they come from healthier places, many times they're not using good quality oils. Soybean oil is inflammatory for most people. Safflower and sunflower oil can be for other people. Certainly canola oil we know is very inflammatory producing. So a lot of these packaged and processed foods have oils that are going to contribute to low-grade inflammation. Coconut oil is good. Coconut oil also has an ingredient in it called monolaurin, and that is known for being antimicrobial, so that can help. Avocado oil can work. Olive and olive oil, grass-fed ghee or butter if you're not dairy sensitive. So those are good quality oils, and the oils will create a better cell membrane. We've got trillions of cells in our body, and if you have a stronger cell membrane, then it's less likely that things can invade inside of that cell, because viruses come in, they go inside of the cell, they release a lot of junk in our bodies and increase our inflammation. If the body just doesn't have what it needs to reduce the inflammation, then that's where you start with problems. And I think you asked about supplements. So basic, supplementation, I always recommend in fall and winter is, let's look at your vitamin C status, not crazy high doses or anything, but maybe somewhere between 1,000 to 3,000 milligrams a day, depending on your needs. Zinc, many of the zinc needs can be satisfied through a multivitamin, 10 to 20 milligrams, more if need be if you get sick. Vitamin D, having your vitamin D tested is the best way to do this, so you know about how much that you need, but general recommendations are about 1,000 IUs a day. Zinc, vitamin C, vitamin D, selenium for some people. Again, many times adequate amounts can be found in a multivitamin, somewhere between 100 and 200 micrograms a day are the dosages. So those are the basics to start with.
Awesome. Now, one of the things that we also talked about is a lot of people are buying supplements. Actually, if you go to the store right now, it's kind of hard to find vitamin C or zinc and things like that. But a lot of people are buying vitamins that at their local store, like CVS, Walgreens, Costco. So I know that one of the things that you recommend is, it's like anything. It's generally speaking, the better quality the product you get, the better quality the product is. There's less contaminants. There's more of the real product. It's been lab tested. So can you talk briefly about some of the supplements that people are going to find on their general counters of, those stores that I mentioned, and versus getting real high quality lab tested, independent lab tested sort of supplements?
Mhm. So, one of the things is if you look at the kind of food that they sell at like a CVS and a Wogs, it can give you a little bit of a better idea of the quality of the supplements that they have there.
Right,
So
right.
if you look at the food that they have at Whole Foods or at your local health food store, then generally they've done their homework. So when it comes to supplements, there's a few things. One is bioavailability. So you get what you pay for. So many times with supplements, there are inferior forms of vitamin C, of calcium, of magnesium. They're very, very inexpensive and they don't cost very much. But inside the body doesn't really know how to make good use of them, and the body doesn't use very much of them at all. So that's one issue, is about picking the right forms that are bioavailable for our body. Second issue is good quality companies are going to take all their raw materials. They're going to send them to a third party to get assayed to make sure that what they say is on the label is actually in the supplement itself. Be tested for pesticides. They're going to be tested for all kinds of toxins. If they're herbs, if they've been sprayed with, fungicides, or they are radiated, etc. So good quality companies are going to pay for all of that kind of testing to look for metals and other contaminants. And then lastly, I would say with poor quality supplements, generally they will put a lot of binders and fillers to make up capsule requirement, or they tightly pack them together and into a tablet, which makes it harder for us to digest and absorb. So if things are in a tablet, a good quality company many times will use an antioxidant as a filler and not tightly bind them or shellac them or add. What's crazy is to add coloring to some of these vitamins. So when you see like FD&C, yellow, red, blue color, it's like,
Yep.
that's crazy that they're putting those inside of a
Correct.
vitamin.
Correct.
Those are the say over the counter. Not that there are not some good things that you can get over the counter in regular stores. You just have to be careful and know what you're looking for.
Awesome. That brings me to another question, speaking about supplements, but then also it ties back to something you just touched on briefly earlier. Can you talk about the gut and the gut health as it relates to the immune system, but also the absorption of nutrients? And then also, can you lead that into a conversation about probiotics and what someone should look for in that regard? Like, is yogurt enough to get enough probiotics, or do you need to eat, or what foods can you eat to boost, the good bacteria in your intestines, and what decreases the good bacteria in your intestines? Because I think that's an important conversation as well.
Okay, so
sorry, that's a lot.
Well, I'm just trying to remember everything you want to cover, so just jump in if I
so first thing,
something.
The importance of the gut.
Okay, so the gut is critical for many functions inside of our body. Not only is it a background player for our immune system, but also affects mood, certainly affects inflammation, and how we digest and absorb plays a factor in our antioxidant status, our inflammatory status, our overall health. So there's no question. And as we age, we lose digestive enzymes. So before we even get to gut health, if we don't have adequate digestive enzyme output, then that affects how we digest, how we absorb the nutrients in our food. It affects what the colonic environment is going to be like as far as the probiotics go. But our body will take foods, vegetables, starches, things like that, and it will break them down and make our own probiotics. So that's how our body makes them. GMOs, we know certain medications, chlorinated water, all of these things can destroy the microbiome in the gut, or the amount of bacteria in our gut. So that's our microbiome. Age can affect it, certainly inflammation, food allergies, all these things. affect the microbiome. As far as
Um, could,
foods,
actually,
yeah.
could you talk about antibiotics, because I think that's one of the big things that will really destroy and disrupt the balance of good bacteria and bad bacteria in the intestines. And I know a lot of people listening to this or watching this, they've been on antibiotics for a long time, and they just randomly take antibiotics, and the doctor never really tells them the impact it has on their health. Could you just talk about that a little bit as well?
Well, it's in the name. Antibiotics. Biotics mean life. Anti is against, right? Probiotics, pro life. So it's just like it's right there. And that antibiotics will kill probiotics or kill off good bacteria in your gut. Also having longer term consequences as far as setting some inflammatory cascades into motion that can affect the body, allowing for the overgrowth of not only bad bacteria, but a lot of times when bad bacteria starts, it's like a bad neighborhood. Other people see it as an opportunity to move in. So, I mean, you can get other things that start to come in, parasites and yeast and things like that, that find a really nice home, and they act as squatters inside of our own body. So, certainly we don't want that. Now, if you need
Sure,
antibiotics,
for sure,
certainly,
for
people need
sure.
to take them. If they do, then they need to replenish with good bacteria, either in a capsule form. As far as the yogurt goes, I don't find yogurt to really be comprehensive enough for most people. Fermented foods have the ability to increase a lot better and more comprehensively. But if you need something more immediately, fermented foods take a while to work.
Hmm.
I would say you really need to go into a good, probiotic. And with probiotics there are some that are grown on a dairy base. If you have dairy sensitivities, you don't want those. There are some very good ones now that are shelf stable. They don't need to necessarily be refrigerated anymore. There's many good options out there. Again, unless somebody really needs more care, I think doing a basic Lactobacillus acidophilus mixed with the Lactobacillus bifidus, those are the two most basic species that we have. That those two species in a supplement can make a difference. And again, I don't think it needs to be at these incredibly high amounts, in the body. If you really are focused on, shifting and other things. I mean, what I've been saying to people is don't squander this time that we have now. Like, use it to look at your health, use
Yep.
it to make upgrades in your health when you can, use it to take time to do all of those things between breathing and exercise and rest and meditation. And certainly, fear and stress taxes the adrenals, which also is part of our immune system, a background player. So while the things I mentioned earlier are your direct immune system, your gut and your adrenals are background players in what your immune system does, and just as vital and critical. So if people could really just take the time to examine their habits and where could they make changes, and they don't have to do it all at once, but
Hmm.
really just try to upgrade your health and just move it up the dial a little.
Awesome, awesome. 100% agree with that.
This is a perfect time to try to do that.
Awesome, awesome, awesome. Okay, so I just want to leave our community. I'm going to put you in the spot here just a little bit. So, in order of importance, obviously all of these things are probably have almost an equal importance. What's the number one thing give me the top three things that you recommend to people to change that are easy, doable things right now to start their moving themselves into a better category, a healthier category, and giving their body the best chance to stay healthy?
Limit processed and packaged foods. Lower your sugar content as much as you can. Lower your alcohol content right now. Eat clean, fresh foods that are very veggie rich. Incorporate good fats. Make sure your blood sugar is stable. If your blood sugar is stable, you may want to consider fasting. By that, right now, a lot of us are under stress, so not too much going on. But if you could take 14 hours even between your last meal of the day and your first meal the next day, that may make a difference. During that time, the body can not only processed toxins, but it can trigger anti-inflammatory substances inside of our body. It could regenerate antioxidants inside of our body. So there is some help. However, if people have blood sugar issues, I don't recommend that for them.
Could you
Yeah.
just, could we just talk about intermittent fasting, just because that's a popular topic. So intermittent fasting, for those of you that aren't familiar with it, is generally speaking about going for a specific amount of time, 12 to 14 to 16 hours of not eating, drinking lots of fluids, but not eating. And then you eat for a very condensed period of time, which gives your body a good opportunity to clear out the old cells, to give the digestive system a rest. Can you just talk a little bit about the benefits of intermittent fasting and how you use it? And you mentioned it, but I just want to reiterate, like, who's it good for versus who's it not so great for?
Well, you did a great job, talking about it. I would say if people are on certain medications, that they're not a good candidate for it, or if they have to take certain medications with food. If you're diabetic or have blood sugar managing problems, hypoglycemia, you're not a good candidate for it. Certainly women who are pregnant, undergoing an illness, I don't think that these are things that are good candidates for intermittent fasting. Otherwise, there's a lot of studies to show that it triggers something in the body called autophagy. Autophagy is the body's kind of reboot and resetting of itself. So that's what can be accomplished with some fasting periodically. For some people, they'll do 14, 16 hours, maybe just 3 days a week. So it's not something you even have to do consistently.
Awesome.
Did I answer everything? Is there
I
something else that I didn't say about it?
No, I think you did a good job with that. So again, just if you're listening to this, this is not medical advice. This is just recommendations that Sherry uses with her clients after she's done a thorough evaluation. So please consult with your own medical professional before trying or using any of these strategies that we're discussing here on this webinar. The one thing that I want you to just mention briefly, because this is a great conversation for another time, but I think it's important to also talk about the role of antacids and these proton pump inhibitors, because so many people are on them, and that also disrupts gut health quite a bit. Impacts your immunity, your ability to absorb calcium, and a lot of other minerals. Can you just mention something brief about it, and then we can come back next time and talk a little bit more about that as well?
So to talk about antacids, I think one thing that I wanted to mention in this, the importance of drinking enough water. So one of the big things for people with antacids is, for many of them, increasing their water intake can have an enormous impact on their digestive health. However, with that said, you do not want to drink the majority of your water with meals. It does dilute your digestive enzymes too much. So getting in adequate water, getting it in between meals is really best. Regarding antacids, they will block off your body's ability to produce acid in the stomach. Acid is needed to break down proteins and absorb certain minerals. Calcium, iron, both of those are minerals that are very acid dependent, and the body needs to have a pH low enough, which releases enough acid in the body absorb those things. I know that in the last few years, it's come to light, people who have been on antacids long-term have a much higher risk of fractures, and it's because that they're losing the ability to digest some of these minerals that are acid dependent. And how you start, you digest north to south, you process north to south. So as you digest, if your pH level does not fall low enough for you to process your proteins well, two things can happen. One, the food can sit there quite a bit longer before it's passed on to the next area. Also, the other enzymes that are a little further down your digestive tract, your pancreatic enzymes and the liver releasing the signals for bile release, those require the low pH of the stomach in order to get triggered for them to release enough enzymes. So, it can just kind of set off a whole cascade of events that just makes your whole digestive tract unhappy, all the way down. And it's an easy, what seems like an easy, quick fix and quick solution can have long-term ramifications, not only for your digestive tract, but for your whole health. And I do think that there are some things that I've read about it also affecting immunity. I know that that's kind of what we wanted to focus on, this time
Yeah,
was
no.
your immunity.
Yeah,
I
for
think
sure.
that so many, over-the-counter medications and some medications in general just have the ability to affect our immune system. And I think, we're seeing this as far as this current virus goes, is that people who perhaps would have more inflammation, lowered antioxidant status, are a little bit more susceptible to it. Uh, so low nutrient function or low nutrient intake is going to make you a little bit more susceptible to this, I think. If you really believe, more than ever right now, I think that, the adage, your health is your wealth, has never been truer. And so I
Absolutely.
think you can see now, if you don't have your health, you don't have anything. So to really spend a little bit more time either, questioning if you are taking a lot of medication, certainly some of them are needed, but, looking at your just random medication use, looking to make good changes in your diet. I know it's a time that we all want to just kind of, curl up and suck our thumb and eat comfort food, but I think that this is a perfect opportunity to really get some good traction on upgrading and moving the needle on your health in a positive direction. At least that's where I'm going with all of it with me.
I 100% agree, because again, if you can't take the time now to take care of your health, when are you going to have the time? And there's never been a better opportunity to be at home and cook food and actually spend time with your family and share the benefit of healthy nutrition and, really take control of your health, take control of the aspects of your health that you really have control over. And that's the food you put in your mouth. One thing you mentioned, Sherry, is water and taking good amount of filtered water. And what is a general recommendation? Obviously, everybody's individual. What's a general recommendation you have for the amount of water you should drink? And again, the importance of drinking water, drink it more in between meals than with meals.
So the water recommendations are kind of based on what somebody's diet is. If they're doing a veggie-rich diet, veggies naturally have a lot of water, fruits have a lot of water to them. If they eat moister foods, if they're eating soups and things, then your actual water level can be a little bit lower. And I'd say that I also see people who I think consume way too much water because they hear that they should, and more is better. And I think that that's not right either. Everything in the body is like this Goldilocks area, right? We don't want too much of anything. For example, some people are sending me articles where they're reading that 75 milligrams of zinc is good to take right now. Well, zinc has a relationship with copper. It's got a relationship with selenium. So it's like if you take too much of that, you throw out of whack the other minerals. So the American way is always, if this is good, more must be
More
better,
is better.
right?
Yeah, right.
That doesn't hold true for anything, including water. So you want to hit your sweet spot. How much does somebody sweat? How much do they exercise? What kind of foods do they eat? If they're not doing a lot of processed packaged foods, if they don't do huge amounts of meat, which can be dehydrating, then I would say some people can get by 6 to 8 glasses. Some people need 8 to 10. It all depends. If they're dehydrating, that could increase your needs, but it doesn't all have to be through just water. Again, I try to incorporate more foods that allow for better water absorption. You take something like broths, whether it's a bone broth or something like that. They are what's called more hydrophilic. So they have the ability to put water inside of our cells a little easier because they've got a little minerals attached and things like that. And by that, I'm not saying to everybody go out and drink mineral water, nor add a bunch of stuff to your water. If you eat foods that have minerals and you consume soups and broths and things like that, you should be able to get it. Or in the summer, more fruits or fruit and veggie juices, things like that.
Awesome. Great. Well, thank you so much, Sherry. You've shared a lot of great information, and I really enjoyed listening to you all the time and having you part of our community and as part of our medical team here in our clinic, Chicago Integrative Movement Specialists. I would love to have you back on again. And you and I have talked about doing a collaborative ongoing sessions for individuals that want more of this information. And also, I want to leave people also with how do they get in contact with you? Because as we mentioned all through this presentation, this is not medical advice. This is not recommendations specifically for you that are listening to this, that you have to take your own medical professionals' advice for treatment, for recommendations, dietary, as well as your fluid intake, as well as your supplements, as well as your medications. But if somebody wants to work with a qualified professional like you, Sherry, how did they get in touch with you?
My website is sherrybelcher.com, SherryBelcher.com. You can contact me there. There's a couple of different ways to do so. And thanks for having me, Evan. It's been great to see you.
Awesome. It's been a pleasure. And I look forward to being on your podcast next, because we're going to talk about posture and movement. And what's interesting about, we'll finish up with this, is we were talking about digestive enzymes and sort of regurgitation or gastroesophageal reflux disease. And one of the things that causes GERD or heartburn is how someone's breathing, because the diaphragm is, or I should say your esophagus goes right through your diaphragm. And a lot of people, they do not have their diaphragm positioned in the right place. So they will get a lot of regurgitation, and then they'll go on these antacids. So they're not even addressing the original cause of why they're having regurgitation. And there's been a lot of research, so research-backed studies that looked at people changing their breathing and actually changing gastroesophageal reflux disease or heartburn. So I'll talk a little bit about that on your session later on today, and we'll make that available.
And to your point, I mean, it just goes to show, like our body, you got to address the structural piece. You need to address the chemical piece. We're just, we're a lot more than just two-dimensional, one-dimensional. You need to look at it all.
You need to look at it all. Well, thank you again. And again, if you want to find out more information about Sherry, go to her website, Sherry Belcher, that's SHERRY, Belcher, BELCHER.com, and you can reach out to her via the website as well. Thank you again, Sherry. We'll be back again. I look forward to speaking with you further. Have a great day, and we'll see you next time.
Bye-bye.